710 KURV.
Someone paid some money to conduct a study to discover if over-the-counter cold medicines really work. Let's take a look at the results. Medical expert Dr. Russell Skinner joining us on 710 KURV. I would vote yes, Dr. Skinner, because most cold remedies seem to knock you out cold. You fall asleep. You don't suffer from the cold for a while. If you look at it from that perspective, I guess it works.
Yeah, some of them definitely do that. This study was looking at whether or not the new cold remedies, particularly those containing phenylephrine, were any better than nothing at all.
Okay.
And this particular study showed that those preparations containing phenylephrine really didn't provide any benefit over a sugar pill.
What is phenylephrine as compared to what is the traditional cold remedy?
Well, the original, going back to about 2005, was pseudoephedrine, and that's the one that most people are familiar with. You know, Sudafed and Actifed that all have the pseudoephedrine.
Stuff that hyped you up.
Yes, and there were several studies that showed pseudoephedrine having a significant effect on relieving congestion. But after 2005, they moved those products from the shelf to behind the counter.
Because crystal meth.
Crystal meth, exactly.
Yeah.
The pseudoephedrine was the primary ingredient in cooking methamphetamine.
So no one has devised a way to abuse the phenylephrine yet.
Correct.
I guess.
Yes. Correct.
Okay.
And the pseudoephedrine is still available. You just have to go up to the counter like you would pick up a prescription and ask for Sudafed, and then they check an ID and you sign for it, and you can only buy so much at a time.
Yes.
But it is still available. But most people either don't know that it is, or they don't want to stand in line there at the pharmacy counter, so they want to grab something off the shelf and head to the checkout.
Okay, new cold remedies with phenylephrine, the over-the-counter stuff. Does it really work? That's our topic right now. Medical expert Dr. Russell Skinner on 710 KURV.
Dr. Skinner, Tim Sullivan here. Any side effects from this new phenylephrine?
No, and it actually has been in use since 2005, in everything that had Sudafed in it before, and so most of the over-the-counter preparations just simply change the ingredient, not necessarily change the name. So you get, Robitussin multi-symptom relief. It has phenylephrine now instead of pseudoephedrine that it had before. So the labels and the names of the medications that you're used to getting didn't particularly change. So a lot of people, may have noticed, I used to be able to take NyQuil, and it really, really helped my congestion, and now it doesn't seem to work as well. But that's because of the ingredient change. You can still get the preparations with Sudafed, but the ones that are there out on the shelf in the aisle contain phenylephrine. And this study says that phenylephrine doesn't provide any additional relief over not taking anything at all. Now, there were some older studies that showed some benefits, so the question is, which study to believe.
Yeah.
And I think they're going to need to go back and probably review all of them and how they were done and what symptoms they were looking at relief for and how those were rated. But definitely if someone has significant cold symptoms and congestion is really a problem, if they really want something that they know will work, then it may be worth standing in line there at the pharmacy counter and actually getting Sudafed. However, if you take those over-the-counter remedies and get good results, then you may be in that group that it really works well for. Everybody metabolizes a little bit differently. Everybody's bodies are a little different. And if you were taking a medicine and you go and you say it works for me, then there's no reason to change.
And for some people, medicinal tea and chicken soup work just fine too.
That's true.
Absolutely.
A little bit of rest.
Absolutely.
Before I let you go, about 10 seconds, Doc. Phenylephrine, does it last longer than the pseudoephedrine, all that other stuff?
No. They're both given about every 4 hours.
All right. Thank you, Doc. That's Dr. Russell Skinner joining us on 710 KURV. Wash your hands. Avoid the cold.